Hey, welcome to the first ever episode of The Decibel. I'm Tamara Kandaker. So the one question that's on my mind these days, and I'm sure you can relate, is, are we in the home stretch of this pandemic? The answer to that question really depends on where you look. Quebec seems to be moving in the right direction after enacting some strict public health measures. Ontario's deadly third wave is cresting, but a fourth wave isn't totally out of the question. Alberta has had the highest case count of anywhere in Canada for days. Meanwhile, Atlantic Canada was doing really well with its bubble, but Nova Scotia now has more active cases than they've seen this entire pandemic. Obviously, we're not in the clear. So, where does that leave us? Over the last year and a bit, I've turned a lot to André Picard. He's the Globe and Mail's health columnist. His writing has given me a lot of perspective on how we should go about fighting this pandemic, and I've often walked away feeling a little bit more hopeful. Today on The Decibel, I'm going to ask André some of my burning questions about the state of affairs, but also about what this has all been like for him as someone who spent his career covering some of the worst health crises this country has seen. Welcome to The Decibel from the Globe and Mail. Let's get into it. André, thanks so much for being here as our very first guest.
Yeah, it's a pleasure. It's a great honor to be the first guest. I'm looking forward to adding the podcast to my morning routine.
I'm so happy to hear that. So you've been covering Canada's health crises for decades. There was SARS in 2003, the HIV-tainted blood given to patients in the 80s. How would you describe this pandemic in the context of your career?
The pandemic I've covered the most is AIDS. So I've been covering AIDS since the early 80s, which is the biggest pandemic in history. It dwarfs COVID by a lot. It's 75 million people and counting. So we have to keep that in context, but it's a different kind of pandemic. This one is really intense, it's global, and it's immediate. So it's very different from something ongoing like AIDS. So it's been unprecedented in at least the last century.
I wonder if you could place us in a global context. How are we doing compared to other countries?
Well, I think like many things, Canada's fair to Midland, so we're kind of in the middle of the pack. But, things are looking up. It is a time for some optimism because of vaccines. So there is some hope there after months and months of being pretty depressing.
Is this where you thought we would be at as a country right now in this pandemic when you started covering this?
I don't think I had any idea, to be honest. I really thought at the beginning, here's SARS redux. There's some of us old health reporters who way back in December saw the stuff coming out of China and went, oh no, here comes SARS again.
In 2003, SARS, a previously unknown respiratory illness, spread to Canada. Nowhere were the effects felt more acutely than in the city of Toronto. SARS was not detected quickly enough, nor was the public health response adequate.
I expected, oh boy, we've learned the lessons from SARS. We're not going to make the same mistakes. This is going to be a burst of death, and then we're going to wipe our brows. And it's been quite the opposite of that. It's just been a lingering pandemic that just never ends because we never really do everything in our power. It's just an endless series of half measures.
The science is evolving so quickly, and it's hard, even as a journalist, to keep up. And last week, for example, the National Advisory Committee on Immunization confused me and probably a lot of our listeners when they said that the Pfizer and Moderna vaccines were, quote, the preferred vaccine. Can you explain to us why they said that and try to clear up some of that confusion?
NACI, the National Advisory Committee on Immunization, these are great scientists. They do terrific work. They're volunteers. I really am careful to not be too critical of them because they do tremendous work. But they had a communication failure here. And what it was scientists speaking to the public as if the public are scientists. You have to have a simple message, not because people are stupid, they're not, but just because they have too much to think about and they don't need to get down into the weeds. What people need to know is you should get whatever vaccine is offered to you because they all work. They're all 100% efficient at preventing death and severe illness. So they're all the same for all intents and purposes, with very few exceptions. And what are those exceptions? If you're pregnant, don't get AstraZeneca. If you're under 30, maybe 40, you should think twice about AstraZeneca. Maybe choose another option.
Yeah, I'm just thinking of Ontario in particular, where throughout the last year, it's been tough to figure out what is and isn't allowed under the government's restrictions, the messaging around who is and isn't eligible for a vaccine, how to get access to an appointment or a pop-up clinic. What kind of impact do you think this kind of confusing messaging has had on our progress fighting this pandemic?
You know, I do a lot of interviews and people ask me, what can you do in Ontario? And I say, I don't have the slightest idea. I don't know what a red zone or a gray zone or an orange zone is anymore. The color coding makes no sense. So yeah, this stuff matters to people, and it shouldn't be that hard to get good information is the bottom line. And it has to be said, Indigenous communities have been the shining light in this. They've done good public health measures. They've controlled the pandemic. They did their vaccinations first and best. They've been a model for this. And I think a lot of that stems from H1N1. We didn't give this a lot of coverage, but during H1N1, there were massive deaths in Indigenous communities in Canada. And they learned lessons from that, and they vowed it wouldn't happen. And also speaks to the fact that if you give local control, you get good results. And I think there's a lesson there for the rest of Canada.
Can I ask you, only if you're okay with answering this, but have you been vaccinated yourself yet?
Oh, yeah, I'm happy to talk about that. I got my vaccine in the last week. I posted my vaccine selfie on Twitter, and I've got my first dose.
Which one did you get?
It was interesting because I went to the clinic and they gave me the whole spiel about the thing. And I said I didn't want to know until after I was vaccinated, because I've been writing for many months saying I'll take whatever's on offer. I'll take it. And I didn't want to be a hypocrite. So I said, give me the vaccine. And then I got my card, and it turned out that it was Moderna. We talk a lot about AstraZeneca, but we forget this too, that the vast majority of all vaccines in Canada are Pfizer and Moderna. We have very, very few doses of AstraZeneca. I think it's only about 1.5 million to date. It's a very small number out of the 15 million doses we've administered. So we're getting worked up about a product that's pretty marginal at the best of times.
You didn't want to know which vaccine you were going to get, but if you were offered the AstraZeneca, I assume you would have taken it.
Oh, absolutely. Without question. Yeah. If I was a pregnant woman, I would not have, but I'm not.
Have you had any luck convincing people who are vaccine hesitant to change their minds?
Vaccine hesitancy is a spectrum. It's not a black and white thing. And I think, I read all the research about this. I know that the most influential people are peers. So it's not me that's going to change somebody's mind. It's their neighbor, it's their friend, it's their sibling, etc. And hopefully they're reading information and they're using it to convey. But I don't know if I've influenced anybody personally.
Yeah, that makes sense. I found this with people in my circle, not my immediate circle, but, friends of friends who are hesitant to take the vaccine. They're not anti-vaxxers, but they have doubts and questions based on things that they've read. And I wonder if you have any advice for people who are trying to have conversations with people like that.
Yeah, I think, one of the most uplifting things for me out of the pandemic is we've stopped talking about anti-vaxxers, that it's this black and white thing. I think we've recognized this is a complex issue. So how do you address people who are vaccine hesitant? You don't dismiss them. You say, oh, why are you hesitant? Oh, that's interesting. I understand that. You're scared of needles. You say, okay, well, I understand you're scared of the pain, but there are creams for that. You could use something called Embla. It numbs you. You won't feel the needle, etc. And by the way, the COVID needles are very, very tiny. You don't even feel it. It's less than a pinprick, which is great, especially when we're talking about kids and they're coming up soon. The other thing about addressing vaccine hesitancy is when they say something that's entirely ridiculous, then you have to confront them. This week's nonsense is that protein spikes can be transferred. You can catch them from somebody who's been vaccinated. And you say, oh, I read that too on the internet. I found that funny because that is impossible. It can't happen. So I think you should go back and read a little more on that one. It's all about conversation. And people, they want to be challenged as well. People are not sure about their opinions. So I think this conversation thing is healthy.
pretty blown away by how much you have been doing on top of the column that you write for The Globe. In the first half of the last year, during this pandemic, you also wrote a book called Neglected No More about how we care for our elderly or don't care for them. The way that COVID spread in long-term care homes is one of the worst tragedies of the pandemic, but the whole book is about how we had not been caring for our elders as a society for long before this moment. And you wrote, quote, "You can bet your lunch that no individual or organization will be held to account for the mass death of vulnerable seniors." What makes you so sure of that?
I've been doing this for a long time, so I have much experience in seeing how governments react. And unfortunately, nobody is ever called to account in Canada. Thousands of people died between March 22nd and April 22nd of 2020. Maybe 5,000 people. This was a mass death event that I don't think we understood fully in the media at the time. And Premier Ford came out and he said there are going to be repercussions. We're going to investigate this. There will be criminal investigations. Well, they never followed up on that. They did absolutely nothing. There was not a single police investigation, independent investigation. There was zero. Zero has been done. We've had 24,500 deaths in Canada. 17,000 of them have been in long-term care facilities, and nothing has happened. Nobody has paid a price. I covered the tainted blood tragedy for many, many years. The biggest preventable public health disaster in Canadian history, probably 30,000 dead in that one. No one went to jail. The Red Cross went bankrupt. A couple of pharma companies paid some payouts. Nothing happened.
Yeah.
That's what allows me to make broad, sweeping statements like nobody will pay.
What would accountability look like?
I think what we have to do is make institutions pay. And I don't mean financially. I mean, we have to force them to do things differently. I think that's the most troubling thing to me is in the follow-ups, there's no obligation to change. There's a lot of apologies, etc. You know, we do these inquiries, but I say in the book, to me, an inquiry is not useful unless a government says up front, we're going to implement whatever's recommended. If you don't say that up front, then it's just hot air to me.
In the US, it's becoming more widely accepted that herd immunity is no longer an option. There's a lot of experts who are kind of shifting their thinking on that and saying that people may have to come to terms with learning how to live with the virus, kind of like we do with the flu. What are experts saying about that here? And I guess what I'm asking is, when will the pandemic be over?
We've never really had herd immunity to anything, if you want to be honest, on the technical definition. So I don't think it's useful to talk about it. I think it's useful to talk about it in the terms you use. So when is it going to be over is when we have enough people vaccinated that the virus isn't circulating readily in the communities. It's going to be like measles. We don't get measles cases except with rare exceptions. Why? Because it's just not out there. You can't catch it. That's what we want to aim for with COVID. Now, it's a little more difficult because the measles never mutates. It's going to be a little easier to control than the flu, I think. You know, we talk about the variants. Those are minor changes compared to the flu, which is kind of a total reassortment every year. So I think what we're going to see eventually is there's going to be COVID cases, but the vast majority of us won't have to worry. We'll probably get our annual booster shot probably at the same time as the flu, and it'll just be part of our daily lives. The important part of your question is, when will this happen? The pandemic's not going to end with a victory parade. It's going to be just kind of fade away out of our lives. It's gradually going to disappear. So I don't think you can put a date on it. But I think what we have to start thinking about is, you know, the old adage in public health that no one is safe until everyone is safe. What's going on in India now is very, very troubling. I think that should really worry us because that's going to extend the pandemic by potentially years in the world. Yeah. So if we want this to be over, we have to stop being such self-centered wusses and start paying attention to the whole world and not just to ourselves.
Ontario Conservatives just put out an ad about border security.
Trudeau didn't close the borders when the pandemic started. He didn't close the borders when it got worse. Nobody wants a fourth wave. It's time to act. A message from the Ontario PC Party.
I was just wondering if you could talk a bit about what role border security plays at this point and if that's what we should be focusing on.
The main reason we have spread of COVID is not because people are coming from other countries. We always like to say, oh, those nasty foreigners, they're bringing disease. That's kind of something that's been repeated throughout history, but that's not a huge issue. We don't know that the variant that originated in Britain actually came to us from Britain. It could have come from any number of places, but, hopscotched around. So I think this stuff is complex, and what we choose to measure makes a difference. We obsessively measure travel. That's the good thing about it. It's really easy to track travelers who are infected. It's way more difficult to track people infected in the workplace because we don't pay attention until there's people at Canada Post who are infected. And then we go, oh, there's an outbreak at Canada Post.
A lot of us are really at our wits' end with all this. We're feeling stress and despair right now about the state of things. What do you do to cope with that feeling of relentlessness, and what gives you optimism at this point?
Oh, I think the vaccines definitely give me optimism. I see in countries where there's a lot of vaccination, things are dramatically better. We have to have some perspective. We look back a year. No one dreamed that we would have a vaccine in less than a year, let alone 6 vaccines. No one dreamed that they would be essentially 100% effective. I remember writing in March, April 2020, oh, if we're lucky, we'll have a vaccine in 2 years. It'll be 50% effective. Don't forget AIDS. We've been trying to make a vaccine for 40 years. We haven't succeeded. This is a miracle of science. It's amazing what we've done. I think of how people have really done remarkably well, given everything, all the challenges that have been thrown our way. We're doing well. We get out and have a walk every day. Most people are working. The economy's going more or less. Again, it's all about perspective. It's about balancing. Things aren't as dire as they always seem.
André, it's been a pleasure. Thank you so much for coming on The Decibel. I hope you get a vacation soon. I really appreciate you being here.
Thanks. It's a pleasure.
All right, that's it for today. I'm Tamara Kandaker. Our producers are Madeline White and Kasia Mihailovich. David Crosby edits the show. Angela Pacenza is the Globe's executive editor, and special thanks to the Globe's deputy editor, Sinclair Stewart. Thank you to André Picard. You can find him on Twitter at PicardOnHealth. I want to know what questions you have on COVID-19 and the months ahead. What are you thinking about? What's worrying you? And it doesn't have to be COVID related. Tell us what you want us to cover. We really want to get to know you. You can email us at thedecibel@globeandmail.com. You can also follow me on Twitter at Anima_TK. And the best way to help us as a new show is to follow us on your podcast app, write us a review on Apple Podcasts, and tell your friends about The Decibel. Thanks so much for listening, and I'll talk to you tomorrow.